Hello everyone, and welcome back for part 2 of today's virtual lunch and learn. For this segment, we'll be focusing all about low back care. Again, we want to mention that this information is intended for educational purposes only, should not be interpreted as medical or financial advice. Enjoy! Let's start off by testing your knowledge. How many adults will experience low back pain at some point in their lives? The answer, 80%. 80% of adults will experience low back pain at some point during their lives. Low back pain is one of the biggest reasons for missed work days and the leading cause of job-related disability. So what are some common causes of low back problems? There are many things that can cause low back discomfort, which include sprains and strains, which may come from causes such as poor lifting technique, lifting an object that is too heavy, twisting or overstretching / moving a load or performing a task away from the body. We have trauma, which could be included from sport injuries, accidents, or falls. Problems with intervertebral discs, which are discs that cushion the vertebrae within the spine. They can be ruptured, bulged, or degenerate over time. There's also arthritis and other medical conditions such as scoliosis, fibromyalgia, pregnancy, and more. And we also have many other factors such as a compressed spinal nerve, skeletal issues, or infections. While many health concerns or injuries can cause low back problems, many times back problems come on over time due to lifestyle factors or even as a result of one bad movement. Perhaps you or someone you know has experienced a problem with one bad movement or lifting something too heavy. Examples of both include an inactive lifestyle. Physically fit muscles are much less prone to injury. Staying in a single position, such as sitting or standing, for too long may cause discomfort. Poor posture, such as while sitting, standing, or driving, especially when in the same position for too long. Exertion and work and play, such as the weekend warrior who is sore after being much more active than their body is used to. Poor body mechanics, poor lifting technique, bending, reaching, lifting or carrying objects that are too heavy, etc. Tobacco use, it interferes with nourishing the body and it also slows healing. Coughing may also lead to back pain. Poor sleeping position or a mattress with poor support. And stress, it has several effects on the body and may increase muscle tension. Behavioral health concerns such as depression and anxiety may influence pain and how severely it is perceived. There are things you can do to help prevent low back problems. When building your fitness routine, start small and gradually increase time or intensity. Don't be a weekend warrior. Also, strengthen your core muscles. The core muscles are found in the body's trunk, and keeping them strong helps support the low back. It's important to remember that your core is not just your abdominals, but also your low back and everything involving your hips as well. Make stretching a regular part of your routine. Stretching may help reduce stiffness, increase range of motion, and reduce the risk of injury. Keep moving. A sedentary lifestyle or staying in the same position for too long increases the risk of back problems. And learn proper posture and biomechanics. Work with an injury prevention specialist or a qualified fitness professional who can help you guide movements specific to your work. And also listen to your body. If you feel pain during an activity, stop. Don't just push through it. If you experience back discomfort, there are some things you can do that may help. Acute or short-term discomfort often improves on its own with time. However, you can use hot or cold packs to help relieve discomfort. It's also important to keep moving as much as possible to help and reduce stiffness. Sitting or lying still may actually make discomfort work, and movement does help with the healing process. NSAIDs or over-the-counter pain relievers such as ibuprofen, aspirin, naproxen, etc., as well as other analgesics such as acetaminophen may help, but do use with caution, especially if you take other medications, and take them according to the package instructions. It's best to talk with your provider about taking any medication you have not taken before or are unsure about. For chronic or long-term discomfort, hot or cold packs may help to relieve discomfort. Regular physical activity, such as resuming being active as soon as possible while avoiding movements that make the discomfort worse, will help your body heal. Also, it's important to maintain healthy lifestyle habits and to promote healing and help prevent future discomfort. Examples include choosing a nutritious eating pattern, getting adequate and good quality sleep, giving up tobacco if you use it, and finding ways to relax and effectively relieve stress. And medications, over the counter or prescribed, may help if they are recommended by your healthcare provider. Here we're going to discuss some common stretches that can be utilized to help relieve low back discomfort. However, it's important to remember that this is not a conclusive list of stretches for the hip as well as the torso, and it's also important to consider strength exercises when dealing with low back issues. If you ever have any questions about this, we at the Place for Wellness or a medical provider can be a very valuable resource to help get you started. It's also important to remember that when you're doing these stretches, if you feel discomfort or pain, you should complete the stretch more gently or discuss this injury with the fitness professional or your medical provider. For the hamstring stretch here, which we'll be starting with, place one leg in front of you, keeping your heel on the ground and knee straight. You may wish to stand next to something for balance. Keeping your back straight, place your hands on the thigh or hips for support and lean forward at the hips. Repeat this on the opposite side. You should feel a mild pulling sensation. If you experience discomfort, perform the movement more gently. The back bend. Place your hands on your hips and lean back slowly in a controlled manner. If you experience discomfort, perform the movement more gently. Pause for a few seconds, then return to the starting position. The quadricep stretch. Stand behind a sturdy chair with your feet shoulder width apart and your knees straight but not locked. Hold onto the chair for balance with your off hand. Bend your leg back and grab your foot with that same side hand. Keep your knee pointed to the floor. Gently pull your leg until you feel a mild pulling sensation within your thigh, and repeat on the opposite side. If you can't grab yourself by the ankle, loop a resistance band, belt, or towel around your foot and hold at both ends. While low back pain often improves on its own, there are some situations where it's important to seek care from a doctor, as there may be signs of something more serious that require treatment. This can include numbness or tingling in the legs or extremities, severe pain that is not improving, pain caused by a fall or injury, pain only at night, and back pain with trouble urinating, weakness, fever, or unexpected weight loss. What will you do next? Here are some possible next steps to keep your low back healthy. Ask about an ergonomic assessment or job site work analysis to help you learn proper movements in your daily work. Try a simple low back stretch, such as the ones we discussed today, and break up prolonged periods of sitting or inactivity by getting up and moving for at least a minute or two. Add a few minutes of movement to your day and aim to make it a daily habit. Also, if you ever have any additional questions or would like any more advice, please feel free to reach out to us at the Place for Wellness. We hope you enjoyed part 2 of today's presentation about how to care for your low back. Both the low back and the shoulder can be very complicated joint systems, so if you ever have any concerns, please do reach out. And as always, if you ever have any questions regarding any aspect of your health and fitness journey, we at the Place for Wellness would love to have a conversation with you. Thank you.